I'm Dr. Tanya. Welcome to Mommy Calls, your go-to source for everything pediatrics. Today's topic is breastfeeding and returning to work. It is perfectly possible to exclusively provide your baby with breast milk even after you go back to work. Typically, I recommend that moms start pumping and offering their baby a bottle around 2 to 3 weeks of age, once breastfeeding is well established. If you wait too long, then your baby may not take the bottle. So after your baby's breastfeeding well, around 2 to 3 weeks of age, start pumping. Usually the best time to pump is first thing in the morning, as that's when you might have extra milk after you first nurse your baby. Alternatively, if there's ever a time where your baby takes one side and not the other one, or they're napping and you're feeling really full, go ahead and pump some milk off and store it. Breast milk can be stored in room temperature for up to 4 hours, in the refrigerator for up to 4 days, or in a freezer for 4 to 6 months, depending on how good of a freezer you have. After the first few weeks, you can begin building up your supply, so that way when you go back to work, you'll have an adequate store of breast milk in your refrigerator or freezer. So that way whoever is taking care of your baby can go ahead and feed them your breast milk with a bottle. And remember that breast milk is really the best source of nutrition for your baby. So how much should your baby drink out of a bottle? Well, it may vary. At about a month of age, your baby may only be taking an ounce or 2 at a time. But as she gets older, she'll work her way up to 4 to 6 ounces over the first few months of life. Before you go back to work, talk to your employer and make sure there's a private, quiet room with a sink and a lock on the door so you can pump. Take everything you need in there, go ahead and wash your hands, set up shop. I like to use a hands-free pumping bra, that way I can pump both sides at once and still do a little work, talk on the phone, or even use my computer. Make sure there's a refrigerator at your office so that way you can keep your breast milk cold, and carry a little breast milk carrier or cooler with you back and forth to transport your milk. I'm Dr. Tanya with Mommy Calls.